We're going to move to agenda item 14. This is an item brought forward by myself and Vice Chair Vargas, Framework for the Future, Improving the County's Wellness Delivery System to Address Disparities in Our Society. This is an item many of us who spend a lot of time on healthcare have been working on for a considerable amount of time. And our proposal today basically brings forward two recommendations. One is having our county set up a process to execute county letters of support in the state reprocurement of the Medi-Cal health system plans, along with providing robust and rigorous stakeholder engagement and outreach. I think it's important to note that the part of that should be inclusive of a public meeting where anyone involved in the healthcare system can weigh in and provide some guidance to our Health and Human Services Agency. And so a part of this is moving forward. I think when we look at everything that happened in COVID, we certainly see the tremendous inequities that are present throughout our healthcare system, and we all have a desire to try and have a better system, in particular for those almost 900,000 San Diegans that are a part of our Medi-Cal lives in our counties, those that are covered by the state version of the federal Medicare system, Medicaid system. And a challenge that we encounter and run into throughout the system is around the structure of the system. And how it is set up. And so we're at a unique time and place where the state is going through a redesign and rebuild of what this structure will look like for counties. And so I think this presents an opportunity for us to engage with the public, for the county to get engaged in what we're doing, and really be a part of continuing to move forward with trying to better serve these communities. A part of the challenge that is unique to San Diego County in the Medi-Cal market, which the state has recognized, is the very fragmented nature of our delivery system. In most counties throughout California, there are one plan or two plans or a county organized health system and maybe one additional plan. But in 1993, the previous board decided they didn't want to have any particular involvement in this process, and San Diego County was carved out of the way 90% of California presently operates in the Medi-Cal market. We're known as what's called a geographic managed care. Us and Sacramento are the only two counties in the state of California with such a plan and such an approach. So what that means in practice is we have 7 different Medi-Cal plans that are involved in the lives of these almost 900,000 San Diegans. That creates tremendous challenges for our providers. Each of these plans has their own unique bureaucracy. They have their own priorities. They have their own things that they fund and reimburse in their own unique way that they go about it. And so what we continually hear from everyone in the healthcare space who provides the services to these lives is how challenging and difficult it is to navigate the system, and a recognition there's a reality, there's a reason why 90% of California doesn't operate in this way. It is not as efficient, and as recent California Healthcare Foundation report has outlined, it doesn't get as good of outcomes. So the state, as a part of the reprocurement of the Medi-Cal contracts, is saying that San Diego County will align with the rest of California and most likely go into a 2-plan model. This is the decision the state of California has made. The state will also decide which plans will be here. What we are doing today is having a public process, a stakeholder process, an engagement process, so that we can work with the communities through this process. The state will be putting out the specific criteria of the procurement, and then as a county, we can consider things that might want to be added to that, and we can participate in a letter of support process. Meaning once those state criteria are clear, if we have county things we would like to add, then any plan who applies and meets those criteria would get a county letter of support. As many of them as meet those criteria, that's as many letters of support as we would do. And then those will be sent to the state, and the state alone will make the procurement decision on which plans will be operating in San Diego County. And so again, it's a pretty significant change for us here in San Diego County, but it is not an unprecedented situation. I just want to reiterate all but 2 counties operate in a measure more similar to what we will be moving forward with. And I think this aligns with our board's interest in trying to do everything that we can to try and help this population and support. So today's action, reasonably simple, have us participate in the support letter process, give us some opportunities for public engagement, process feedback, work with stakeholders that are involved in the healthcare space, with community groups, and really be a part of the system. I also want to say this is a multi-year process. It is going to take some time for the state to award the contract to the next Medi-Cal plans, and then there will be multi-year phase-in process as we work through helping each of these individual lives go where we are. But we think at the end of this, we will arrive with a Medi-Cal system that has more consistency, that is easier for our providers to accommodate, and will provide more services, particularly those services that we think are most vital and most important. So it's an important step forward, and I think us being engaged in the process is a positive step. I'd like to go to Vice Chair Vargas, who brought this item forward with me. Then we'll hear from our public speakers and return to the board. Vice Chair Vargas?
Yeah, thank you, Chair Fletcher, and I'm really honored to be bringing this item forward with you. As someone who has been in the public health care arena for over 20 years, I think this is extremely an important opportunity for us to recognize that, particularly that public input is such an important component. And so I think that the fact that we will be bringing stakeholders to the table to make sure that their input is being considered as we look at ways to improve our county wellness managed care system is a critical piece to this board letter. And so with that, I'm really looking forward to continuing our conversation and moving forward and advancing better healthcare outcomes for all of our communities. So thank you. I'm happy to second the motion. Did you make a motion?
I'll make a motion.
And then I'll
motion in a second.
There you go.
All right. Let's go now to our public speakers.
Thank you, Chair Fletcher. We have 7 requests to speak on this item. We'll begin with the in-person speakers. Those individuals that requested to speak by phone, please dial into the conference line now using the instructions that were provided to you. I'd like to invite forward Karis Grounds and Demetrius Alexiou. You'll have 2 minutes to address the board. We'll ask you to please state your name for the audio record. They'll be followed by the speakers in opposition of this item, Danielle Salinas, Sean Fredrickson, and Audra Morgan.
All right, good afternoon. Chairman Fletcher, board members, my name is Karis Grounds, and I'm the Vice President of Health and Community Impact at 211 San Diego. And on behalf of 211, I'm here to offer our support for the framework for the future. 201 San Diego is proud to have worked with the county and the region's many health partners in response to the COVID-19 pandemic. Thanks to Chairman Fletcher, Vice Chair Vargas, the entire board, Nick Mascione, and the public health team, our region responded to the once-in-a-lifetime pandemic through an equity lens, ensuring our underserved populations received assistance and access to COVID-19 testing and vaccines. 201 San Diego sits on the crossroads of supply of social and health resources and the demand for those resources. We can all agree that the pandemic shed light to the disparities of our healthcare system and the system of care in general. We work with those disproportionately affected each day. Our 201 staff saw these disparities, and they heard the desperation for help for callers who spoke of the barriers they face accessing critical resources. We work directly with the county teams to address individual and systemic barriers. San Diego is lucky to be the home of the Community Information Exchange, or CIE. And 201 is the backbone organization honored to really lead this work of the nationally recognized CIE, a growing network of 105 health, social, and community-based organizations that are really working together to enhance community care planning. CIE is used by more than 1,400 helpers who provide social and healthcare services in our community, and by sharing this information, we really shift away from a more reactive system to a proactive system, providing holistic and person-centered care. People who agree and have the choice to agree to have their information shared receive that proactive care from those CIE network partners. And currently, over 220,000 San Diegans are participating in the CIE, and the majority of them are from underserved populations. San Diegans get coordinated care through this system. And
thank you.
Again, we would love to support, we absolutely support the framework and know that this will really help our local networks and infrastructure and provide a true collaboration for our community.
Thank you. Next speaker, please.
Good afternoon, Chair Fletcher, honorable members of the Board of Supervisors, Madam CAO. My name is Demetrius Alexiou. I'm President and CEO of the Hospital Association of San Diego and Imperial Counties, and I'm here on behalf of our hospitals and health systems in support of item 14. San Diego's hospitals are a key element of the county's healthcare delivery system, providing high-quality healthcare to thousands of patients every day, of which Medi-Cal is an increasing proportion of the population our hospitals serve. The Hospital Association of San Diego and Imperial Counties and our member hospitals support the goals outlined in the board letter to achieve better health outcomes, reduce health disparities for our residents, address long-term health impacts of COVID-19, and make our region better positioned to handle any future pandemics or strain to our healthcare system. The HASDC Board of Directors developed a set of guiding principles that represent hospital and health system priorities for inclusion with new Medi-Cal managed care contracts. These principles have many areas of alignment with the proposed guidelines and instructions for the optional letter of support put forward. Our members strongly support efforts to strengthen local oversight and increase accountability. Medi-Cal patients face tremendous barriers trying to navigate a complex system. In our 2019 Community Health Needs Assessment Survey, respondents ranked access to care as the healthcare need of greatest impact on the overall health and well-being of San Diegans. This is a once-in-a-decade opportunity to prioritize patients. We appreciate the board's work to improve the health and wellness of all San Diegans and look forward to providing additional feedback as this moves forward. Thank you.
I'd like to call forward the speakers in opposition of this item, Danielle Salinas, Sean Frederickson, and Audra Morgan.
Good afternoon, Board of Supervisors. My name is Sean Frederickson. Thank you for being here to listen to the voices of the community to know exactly how to vote. We, as the citizens of this county, are here to tell you, our representatives, that we do not grant any authority to Medi-Cal, any further authority to Medi-Cal, and which continually ignores the public. As that man stated that he cares about individuals in the hospital, if he actually did, or if these hospitals truly did care about the customers that they have or these residents of the county, why didn't they choose to use ivermectin or hydroxychloroquine? Could it be that politics might be involved? Could it be that maybe this vaccine is more profitable? Could it be that you prefer control over a citizenry rather than a cheap, affordable, effective solution like ivermectin and hydroxychloroquine? There's a fantastic doctor in Houston. He's been interviewed by 1,500 news stations around the world. He speaks 9 languages. Pretty incredible. That man has been on the news so much, and as these news agencies interview him, they ask him, what exactly are you doing to ensure that your COVID deaths, which he's at 3%, while the national average at 3%, he says, well, I'm do this Math Plus program. And then he labels the Math Plus program, but the problem is, all the news stations ignore the plus. What exactly is the plus? Well, it's zinc and hydrochloroquine and ivermectin. If you actually cared, which I'm beginning to realize you don't, about the citizens in this county, you would not control them nor charge them these irate costs and promote pharma over free or even $3 ivermectin pills. Do you understand the frustration as a citizen who is not paid to be here, who is not a part of a union, who's simply a constitutionalist? And I value freedom in this nation, and I value this board to hear what I'm saying. We as individuals, we as free citizens in this nation are feeling the corruption which Cuba has embraced. Do you get my drift?
Time is up. Thank you. Next speaker, please.
I'm Audra Morgan. All COVID shots lead to the creation of a spike protein through a process called translation. The spike protein can damage the body by at least 4 pathways. The spike protein behaves as a hapten, a small molecule that binds to the surface of organs, leading to an autoimmune response. The spike protein can damage organs directly by promoting cardiovascular complications, damaging blood vessels in the lungs and breaking through the blood-brain barrier, important for protecting the brain. The spike protein can incorporate into human DNA through a process called transfection. The spike protein evokes the release of destructive anti-spike antibodies. Spike protein can trigger changes in blood vessel walls, leading to pulmonary artery hypertension, which is fatal even under the best current conventional and alternative treatments. In men, the spike protein can bind to the ACE2 receptor on sperm. Risk of infertility is indicated. Spike protein causes inflammation and disruption of the blood-brain barrier, leading to neuropathy, neuropathology, and brain degeneration. Neurological degeneration, spike proteins can damage the FSU gene and mutate to TDP43 protein, leading to ALS. Neurological degeneration, mutation, and altered function of the TDP43 protein can also lead to FTLD, a cluster of chronic degenerative neurological diseases. Mutation of the FSU gene can also lead to cancer. Previous coronavirus exposure to the concept called original antigenic sin stops true protection against the SARS-CoV-2 if previously ill with coronavirus infection. There's an increased risk of COVID illness and COVID-related deaths in persons who has been previously vaccinated with an influenza vaccine.
Thank you. We'll now hear from those that requested to speak by phone. We'll be calling speakers by the last 4 digits of their phone number. You'll hear a notification that your call has been unmuted. You'll then need to press *6 to unmute your line. I'll ask you to please state your name for the audio record. And if you could please identify the first caller.
Our first caller is 1081. 1081. Please press *6 to unmute.
Good afternoon, Chair Fletcher and Board of Supervisors. This is Kathleen Lang, Vice President, Medi-Cal Regional Lead for HealthNet Community Solutions. HealthNet has been serving San Diego County residents for a number of decades, providing healthcare coverage through Medi-Cal, Medicare, Covered California, employer health plans, and federal services for our military. We appreciate the guidance provided in this agenda item and are encouraged to see that our intentions, as outlined in our CalAIM model of care previously submitted to the Department of Healthcare Services, are in line with the board's direction. Knowing the direction of San Diego County leadership is helpful and will guide planning efforts going forward as we further align with the stipulations, many of which we currently meet or are well positioned to meet. In lieu of services are those optional wraparound services designed for Medi-Cal managed care plans to provide and integrate into population health strategies. Given the volume of work necessary to effectively implement CalAIM, HealthNet has taken a thoughtful approach, partnering collaboratively with community-based organizations, providers, and county agencies to develop an 18-month in lieu of services rollout that launches with 6 services on January 1st of 2022. HealthNet remains committed to collaborating with our partner health plans, baking in as much administrative simplification as possible for our local provider partners so they can focus on what matters most, the Medi-Cal members we serve. HealthNet recognizes the value of CalAIM as a tool to improve the health and wellness of our community and is aggressively building the necessary infrastructure and pursuing meaningful partnerships essential to successful implementation. It is a busy, albeit exciting time. I look forward to working with the board and keeping the board apprised of our progress. Thank you for your time.
Thank you. And that concludes public comment on this item. Also note for the record that we received 3 e-comments, 2 in favor and 1 neutral.
All right, we have a motion by myself, a second by Vice Chair Vargas to approve the recommendations here. Not seeing any requests from my colleagues to speak. Please vote.
You know what, Nathan, I signed in and signed me out and realized that I didn't proceed on the issue.
Okay. So let me ask the clerk if we can just rescind that. No, that's okay. We had technical difficulties. So can we rescind the vote? Go to Supervisor Anderson and then come back? We didn't complete the vote. So Supervisor Anderson, the floor is yours.
Mine's more of a how we proceed question. So we have all these stakeholders. Oh, I'm sorry. I have to push the right buttons, evidently. So I'm used to pushing buttons, but never the right ones. You know, we have all these stakeholders, and we're moving forward. And your explanation was very, very helpful because we're not picking to, we're simply qualifying. But that qualification that we put together, and I know that we have a subcommittee that's going to do it, will that subcommittee be open to the public? And the reason why I say this is I'm concerned that we have these 7 vendors who have done a great job, and I don't want anybody to walk away feeling like the parameters were set, excluding them.
So in my opening comments, I alluded to the need for public meetings where all stakeholders can participate and weigh in.
Excellent.
That-
Well,
that will
I
be a
heard
part of
that,
it
but I
moving
want to
forward.
make sure there was absolute clarity.
Absolutely clarity. Yes, sir.
Perfect. I'm ready to vote for it.
All right, perfect.
Thank you.
We have a motion by myself, seconded by Vice Chair Vargas. Please vote.
Chair Fletcher, that motion passes unanimously with all supervisors being present and voting aye.